Hello, everybody. My name is Ashleigh. This is our program, Step by Step, taking on dementia one step at a time. My group and I are health education and behavior students at the University of Florida, and today we'll be teaching you a little bit about dementia. We want to inform you on the symptoms, how to prevent it, when you should talk to a doctor, and then try to ease a little bit of the stigma surrounding this harsh disease. We will begin by explaining some of the terminology, followed by an explanation of symptoms and their severity. We will have videos to watch, guest speakers, an interactive presentation, and an individual questionnaire at the end to make sure you guys are understanding everything you learned. We will have a couple of minutes at the end to answer any questions, and then we will review the answers from the questionnaire as well. And we hope with this presentation that you gain a little bit of a better understanding of dementia and how it can be handled. So before we can explain what to look for when recognizing what dementia is, you have to understand exactly what it is. So dementia is not necessarily a disease itself, though it is often referred to as that. It is a term that describes numerous diseases that are actually characterized by neurological function loss. So proper definition, according to the U.S. Department of Health, dementia is loss of cognitive functioning, which is thinking, remembering, and reasoning, as well as behavioral abilities to such an extent that it interferes with daily life. You end up suffering from loss of functions like language skills, visual perception, problem solving, self-management, and ability to pay attention. There are several stages to dementia: mild, moderate, and severe, and your age and family history are usually the biggest determinants in whether or not you're at risk. So, remember that we said dementia is not necessarily a disease itself, but is characterized by a disease that results in the loss of cognitive abilities. So a few types of diseases are categorized as dementia are Alzheimer's, dementia with Lewy bodies, vascular dementia, frontotemporal dementia, and mixed dementia. The most common one we see is Alzheimer's, which is shrinkage of the brain, which leads to difficulty remembering and often causes depressive disorders in around 44 million people around the world. This type of dementia has the biggest effect on people as it alters their brain functions and leads to behavioral change that causes them to have such a hard time, with themselves and other people. The next one we see is dementia with Lewy bodies, and this is very similar to Alzheimer's as it can cause memory loss, but it's more often associated with diseases like Parkinson's because it causes tremors and stiffness. It affects a different part of the brain. And this type of dementia comes with hallucination and sleeping disorders. The next one we see is vascular dementia, and this is associated with brain injuries and brain trauma. This can be caused by strokes or incidents like head injuries or car accidents. So you want to try your best to, wear your seatbelt, wear helmets, prevent those from happening. The most side effects of this disease are decision making and memory loss. So, it affects part of your brain that helps you make, right decisions in your daily life. The next one is frontotemporal dementia, and this is where effects are isolated mainly in the frontal and temporal lobes. So this is where your personality and your behavior becomes affected. So your frontal lobe controls cognitive function. So those with this type of dementia suffer from memory loss, but also loss of language skill, emotional expressions, and problem solving. And the temporal lobe mainly controls hearing and speech, again associated with loss of language and talking abilities. And lastly, we have mixed dementia. Pretty self-explanatory. It's basically just when someone suffers from more than one type of dementia. Most commonly associated is Alzheimer's and the frontotemporal dementia. So next we have risk factors. The Alzheimer's Association has done research on the different risks associated with dementia, and they found that there is just not one sole cause of dementia, and it's often associated with several factors. Most of them are ones we cannot change, but there are some that we do have some influence over. So while the greatest risk for anybody is age, dementia is not considered a normal part of aging. Just because you are getting old does not mean that you will have dementia. It just means that your chances are a bit higher as the older you get, as your mind and body ages. Almost 40% of people over the age of 65 suffer from some form of dementia, according to the Alzheimer's Association of Canada. And for every 5 years after age 65, your risk of developing dementia doubles. The next risk factor we have is genetics, and this is one of the strongest risk factors of dementia. If you have a family history of any sort of dementia, you have a much higher chance of developing it. And there are two types of genes that doctors believe affect your risk. It's deterministic genes and risk genes. Deterministic genes are basically a guarantee that this person will develop a disorder, even though only 5% of cases are caused by them. The risk factor gene it could be a possibility, but it could not, and that's where most of your cases come from. One of the risk factors we do have control over is alcohol and tobacco use. Excessive alcohol and smoking can cause brain damage, which can lead to dementia, as it is a brain disorder. Drinking within your daily guidelines is fine, but if you are constantly excessively drinking, then it becomes an issue. Another risk factor we have some control over is cholesterol. This is one where you might have high cholesterol, runs in the family, so you have a higher chance of it. But for those of you who do not, watch what you're eating or take care or exercise, and you have low cholesterol, then you're more at risk for dementia. And if you're in the middle age with low cholesterol, you have the highest risk. Head injuries here are listed as a risk factor because remember we talked about the vascular dementia, which is associated with brain injuries. So we have to put this here because if you have stroke or, like I said, car accidents, football accidents, you are more likely at risk because of the brain trauma. So here we have a discussion question. I'll call on a couple people, take a couple of minutes to fill in the blanks and, figure out listing characteristics of somebody, reviewing what we just went over. Next, we have the early signs and symptoms, and there are many symptoms to look out for in someone who may be suffering from dementia. Typical age for dementia occurs 65, but it can also affect younger people. Early onset of the disease can happen from anywhere between 30 to 50. With treatment and early diagnosis, you can slow the progression of the disease and maintain mental function, which we'll talk about a little bit later. So dementia usually first appears as forgetfulness. To go a little deeper into a situation may look like, some examples, you can have like a flat mood when it comes to things that, used to be your favorite. You're going to your favorite store or park and you're just all of a sudden uninterested. Misplacing items, tasks that used to be daily activities like going to the grocery store, things like that. If you have trouble doing these, this is a sign that you have dementia. Dementia can and usually does worsen over time. So when this happens, the symptoms of the disease become more obvious and start interfering more dramatically with the individual's everyday life. So some of the symptoms may include, listed again, more difficulty with reading and writing, using wrong words or pronouncing words and sentences incorrectly. They begin to have poor judgment, cannot recognize danger like they should, violent behavior, sometimes hallucinations like we talked about. Daily activity is not going well. It's things that used to be easy for you that you are now having trouble with. And at this point in the presentation, we have a little role play activity where we're going to call on some volunteers and they're going to come up and act out a play. So helpful ways you can cope. Informing yourself about dementia and the effects it can have on your life gives you better insight of what can happen. Talking to a family member, having a good idea of what your family history is like. Medical history is important anyways, but it's really important for this matter. Talking with counselors or any members of like a church or your community, anybody. You can talk about feelings of the disease, and this kind of helps alleviate some of the being scared of it. Staying active is also a way to cope. It, releases energy, serotonin, you can relax, it helps your heart, but it also, as a relaxing matter, it does help your brain. Staying physically active is healthy for your brain, which can prevent dementia in the future. You want to try and find new ways to express yourself. That can be a great way to cope, finding things you enjoy that keep you distracted. All right, so treatment now. Recovery is unfortunately not an option with dementia. It really depends on how you got it, the cause of the disease, as well as what stage you are in. With advanced Alzheimer's, which is the most common form of dementia, there's no cure, and if you are in the late stages, the chances of getting any help are really very slim, unfortunately. And while there is no cure and really no way to slow the progression of the late stages of the disease, there are a lot of medications that can help some of the symptoms and, different exercise and therapy options. So the first one we're going to talk about is some of the medications. So this actually does, if you are not in the most later stages, you do have a chance of slowing the progression a little bit if you catch it early on. These ones are for treating those in the mild to medium stages. So it is a neurological disorder and causes disruption of the communication of neurons in the brain and destroys those neurons so they can't connect, carrying information between cells. And these medications stop them from doing that. So the drugs used to treat Alzheimer's, which is what we're going to talk about, because most of the ones that can treat Alzheimer's are also used to treat all the other types of dementia. And they are called, it's kind of difficult to pronounce, cholinesterase inhibitors. And they prevent the breakdown of acetylcholine. And that's the chemical in the brain that is used for memory and nerve cell communication. So 3 different cholinesterase inhibitors are donepezil, galantamine, and rivastigmine. Hard to pronounce. They can all be used to reduce symptoms at the mild to moderate level, like I said. So the donepezil is primarily only used in Alzheimer's cases. And it can also be used in later stages, but is not as useful. Mementamine is a mix of the donepezil and the drug called meneptine, and then the main drug is called meneptine. And it's used to treat severe cases of Alzheimer's. It improves memory and attention span, and it regulates glutamate in the brain, which aids processing, as well as improves mental function and daily activity. So here we have therapy. Using non-drug approaches includes occupational therapy, modifying the environment, and simplifying tasks. An occupation therapist can teach coping behaviors to prevent accidents for things like falls. They can make your home safer and prepare you for the dementia progression. By modifying the environment, you make the home become a place with less clutter, less danger, or like knives and car keys and things like that once you start losing your mind can become cause injuries, as well as noise to make it easier for someone to function. So you basically want to set up your house the best way you can to make this person who has dementia the most comfortable. To simplify tasks, you are breaking down tasks into easier steps. So keeping things positive and keeping things very easy, very baby steps that can reduce confusion and help them. All right, so when it comes to a disease as progressive as dementia, you want to try and get a diagnosis as early as possible. This way, you can seek early treatment and slow the progression as much as you can. So catching the disease early, it allows for a slow progression, like I just said, and you can keep yourself intact, give yourself a little heads up and be prepared for what could happen and knowing the side effects and how to prevent them. We want to talk about when you should be tested. So if you're over the age of 50 and start to notice one of the 10 warning signs, then you should talk to your doctor. And here we have the 10 signs according to the Alzheimer's Association of early onset dementia. First one, you have memory loss, but memory loss to the point that it disrupts your daily life. It's not forgetting the details of the story or forgetting eggs or milk at the store. It's more serious, like getting to the grocery store and forgetting where you are. So it's to the point where it's affecting your daily life, because then at that point you're kind of in a tough situation. The second one is challenges in planning and solving problems. Sometimes dementia can cause a person to have difficulty working with numbers or intense problem-solving situations. If you notice someone's having a hard time doing bills or paying at the grocery store, that could be an early sign. The third one is difficulty completing tasks. This is, just finding yourself struggling to do things in familiar situations, like if you are at your own house and you're picking up and cleaning, and then all of a sudden you forget where the cups go. Something like that. The next is confusion with time or place. This is very common, and this one is often associated with old age as well. Like, as you age, your brain is aging too, so you're losing a little bit of function. But this is more of a serious issue that goes with that. So if you are losing track of dates or seasons more seriously, then it's really important to talk to your doctor at that point, because it could be more than just an aging issue. The next one is trouble understanding space. So vision problems are often a symptom of dementia, and spatial awareness is a very common beginning onset sign. The next one is word problems. This is an early sign if you are starting to lose track in conversations, not just being confused, that happens to everybody, you space out, lose track, it's fine. But if you are seeing that, throughout the day and on your daily life, you're having numerous conversations where in the middle of it you have no idea what's going on, then you really need to talk to your doctor. Number 7 is misplacing things, putting things in a place where you think is safe and forgetting where it goes, or like I mentioned earlier, you're putting away stuff in your house and you all of a sudden don't know where anything belongs. Number 8 is poor judgment, and this is, decision making is one of the subjects most affected by dementia, so it's a more serious warning sign. If you find yourself, a lot of people think this means like going out and beating somebody up. This is more like if you find yourself spending a lot of money when you don't have it, or being reckless, not wearing a seatbelt, things like that you normally do, that all of a sudden you're just kind of like don't care about. Number 9 is withdrawal from social activity. So not being able to hold a conversation makes somebody insecure, and you begin to pull away from social interactions. So if you notice that somebody, like I mentioned earlier, not being able to hold a conversation or not knowing what's going on, this can make them a little bit insecure, and you'll notice they'll start pulling away. This also has to do with the stigma surrounding dementia. They don't want people to know that things are going on with them to make them uncomfortable. So the last one is changes in mood and personality. Finding yourself having mood swings or being confused and depressed are all severe warning signs, and you should talk to a doctor. Personality changes and changes in mood is generally the last one, because you normally have the other ones before that one. It can be another one associated with aging. If a woman's going through menopause, then she could be having mood swings. But we're talking about severe situations. And although most of these are symptoms, and a lot of them seems like the symptoms that we talked about just rewritten, it's important to know that these are the early signs. So if you start noticing these things, pay attention and talk to a doctor. So next. Now that we know the symptoms, we know the signs, we know how to treat it, we can learn a bit about how to prevent it. So like I said, we know there is no cure, and there's not really anything you can do if it's in your genes and you're going to get it. You can slow the progression a little bit, but you can't do, as extreme work and help it as much as you want to. So the first thing we can do, I don't know if you can see this, is not to drink excessively. So remember that excessive alcohol use leads to brain damage, which then leads to dementia. Same with smoking. All these chemicals and toxins in cigarettes, it's been for years, get in your lungs, get in your blood, get in your brain, causes dementia. So don't drink, don't smoke excessively. Stay in shape. This does not mean go out and lose a bunch of weight, be unhealthy, just think that you're thin, you're healthy. This just means, make sure you're eating your vegetables, make sure you're eating fruits, make sure you are exercising. Even if it's not daily, if it's 3 or 4 times a week, get your heart pumping, get your blood flowing, be in shape. Next is be social. Everybody needs social interaction to keep their brain healthy. Scientists have actually proven that being around other people, it can train your brain and train the neurons to go certain ways, and that improves memory and memory recall. So, being around other people not only makes you feel better, but it can help your brain. Last one is, try and do some mental puzzles. Like I said, Sudokus, crosswords, word searches, doing word problems, get like a puzzle book, things like that. They keep your brain stimulated, and that improves for memory formation and as well protects the brain from diseases. Next is reducing the stigma. So there is a very real stigma for older adults surrounding dementia. And if you don't know what a stigma is, it's a negative label on something, based on misinformation or not knowing something about it. There's a significant amount of misinformation about dementia, unfortunately, and this is what causes many old people to not want to go to the doctor. They don't want it, People think that if you have it, you are going senile, you're crazy, you're dying, you're done for. They think with this, you're going to lose friendships, you lose family, nobody wants to be with you, and it's really sad because none of those things are true. But because of that, like I said, people are afraid to go to the doctor and be diagnosed. Many people won't get tested because they believe that if they have dementia, that all these things are true, they're losing their mind, and they feel like it puts a pressure on their friends and family, they feel like they need to be taken care of, things like that. And that's why it's important that once you notice one of those 10 early signs, you go to the doctor and get it taken care of. Because think about, if you see one of these signs and you go to the doctor, and let's say you do get diagnosed with early onset dementia, you can take care of it, slow the progression, get your symptoms under control, and you can have a more progressive life for longer. If you wait until it's too late, then it's to the point where you could have helped yourself in the long run. With it, it's not contagious. We talked about it's a brain disorder. People, for some reason, think that. They don't want to hang around you anymore. You lose friends. They think they could get it from you. If you do get diagnosed with it, you're not crazy. You are not senile. You are not losing your mind. It is the way of life for many people, and if you are not the only one. And for those who are afraid, it's okay to be friends with somebody who has dementia, and honestly, it would benefit them greatly if you remained their friend, as like I said before, social interaction is a great way to keep your brain stimulated, improve memory recall, things like that. And here in the presentation, it's a 20-minute segment by Dr. Melissa Armstrong. She works in the Department of Neurology at University of Florida, and she's going to give a quick, little talk about everything we went over, and as a doctor, what she sees in her side of everything. In conclusion, we really hope that you enjoyed this presentation and got the most out of it as you could. This is where we want to, we hope that you really learned from it. We've provided plenty of information of, doctors, risks, symptoms, everything. With the hands-on activity, you learned how to assess symptoms, of somebody who's at risk and somebody who didn't know how to take care of themselves. You also learned the appropriate time to see a doctor, based on your symptoms. That is very important. And with the help of our lovely guest speaker, all of our points were reiterated, and you got firsthand recounts from a doctor, which is not something, unfortunately, many people get to do every day. If you have questions, feel free. You all did a good job throughout the presentation. We had a couple of discussion questions, and you all answered them successfully. You're all getting the information, we're all listening. And with the information in this presentation, I hope you all are able to put it into good use. Keep yourself safe, aware. With that, we have a little questionnaire. It's 10 questions. We'd like you to answer them. You can answer them now, and we can go over them as a group if you would like, or you can just leave it on the table on your way out, and we will, that helps us, it helps our study so that we can be more prepared for our next presentation based on your answers. Couple of references. I hope you all have a good day, and thank you so much.